Assalamualaikum sahabat.
Waalaikumsalam. Zad, can you hear me?
Boleh, boleh.
Yeah.
Oh, background kat belakang tu silap tu.
Yeah, I don't know what's wrong with my background. I'm sorry.
Alamak. Kejap, kejap, kejap.
Ah, someone is good. Oh, I thought something wrong with my background.
Kejap, kejap. I tengok.
Zad, can you hear me?
Boleh, boleh. Boleh dengar. Ah,
Actually, I'm trying to use my headphone.
Along, nak tukar background lah.
What happened to the background? Your background or my background?
Your background.
I thought that's what you sent to me.
Ya, I tak tengok tadi. I just send apa yang student hantar.
I know you sent something else. You can send me now. So you want me to change my background? Did you send have you sent something else? Zah?
I tengah minta dengan my student. I tengah minta dengan my student hantar yang lain. Hello Nak once I dapat, I bagi you. Long, you pakai yang I baru hantar Long. Biar you lain sikit. Yang ni tak apalah. Sebab ini esok malam punya ni. Dia silap ni. I tak dengar you mute. Okay. Dipakai yang tu Sorry. My mistake lah. I tak check tadi.
Oh, yeah. Yeah, just waiting for it works. I think so. You can hold on.
Hello.
Hello.
Nice. That's really nice. Thank you, Imran.
Anak bongsu yang tolong.
Anak bongsu yang tolong is actually my headphone. Apa ni baru tukar. Yang itu jadi problem. So, wow. Oh, we're getting the student are coming in. So that's good.
Kita tunggu student masuk.
Yeah. So, while we're waiting for the students coming in, maybe we can just chat about mental health. What do you think, Zah? How do we go about it for tonight?
Okay. Kita malam ni, I put you punya tajuk tu memang kita dah pernah buat dulu kan?
Yes,
Because kita orang kan selalu bertukar-tukar student.
sure.
So, just recycle yang sama.
Mm-hmm.
But I pernah dengar dengan you tajuk ni, I rasa just continue je.
Right, right.
Kan?
We got even though the tajuk it seems like tajuk lama, but it's still relevant until today lah. Huh?
Yeah.
Yeah. We're going to talk about it, about mental health, and it doesn't mean that we're going to talk about problems related to mental health, but we want to discuss about things that can help the student lah, how to overcome issues related to mental health and things like that. But having said that, maybe we going to have some kind of free flow at the end, you know, if we have time, inshallah.
I agree dengan free flow because online kan dia kena relax.
Yeah.
Abi kerja awal ke hari ni?
Hari ni is very hectic. Sebabnya have 4 hours of lectures in the morning and then marathon with sesi therapy until 3 and then come back home and getting ready to see you guys.
I see.
It's normal thing. Alhamdulillah. It's not a big deal. Inshallah.
What is the main secret? What is the main secret? Is that liking number one? Let me say liking as number one. We like it. We like our work. We like our job.
Yeah.
Number
Yeah.
one, kan?
It's
Yeah.
helping profession is what you like, and then that's what you do. Alhamdulillah. The more you help others, the more you feel,
Energy.
accomplished. Yeah,
Kan?
energetic.
Energetic.
Yeah, who do
Kalau
we
dalam
have? Yeah.
Zoom malam ni, Long, dalam Zoom
Yeah.
malam ni, kita tak perlu tunggu beratus masuk pun, sebab because kita lancar di masa yang sama, kita lancar on YouTube.
Yes, absolutely. Absolutely.
So, yang masuk Zoom malam ni lah mereka yang engage dengan you sahaja. Yang
Yes.
akan bertanya soalan.
Yep.
So yang lain tu dia akan tengok YouTube lah.
Yep.
Tujuan buat online pun nak memudahkan student, because diorang dah corner nak exam. So kita nak ringankan lah, kita tak nak lah buat talk face to face every night kan. Tu yang kita selang-seli dengan online.
Yeah, we take it easy. Kita tengok macam mana sambil-sambil dia orang study, sambil-sambil they learn about one or few things, kita punya sharing session will be like 1 hour and half, something like that.
Yeah,
We have
yeah.
question. And kalau dapat satu ilmu, jadilah malam ni. Kita tak dalam banyak-banyak tu, banyak sharing tu. If you can take one thing, one point that you can remember, that you can use, cukup lah. Ini kita panggil learning process kan.
Yeah.
So you let me know when we want to start. Shall we start now or what?
Kita tunggu. Kita tunggu. Kita start kita tunggu sebab banyak yang baru join ni.
Yeah, we
sebab
have
MC akan start nanti.
Okay. Who is our MC today?
Our MC Wafa. Wafa is our.
Wafa.
Okay, Wafa. Okay. Wafa, kita nak start pukul berapa? Prof dah tanya.
8:45 kan, Madam?
Okay, kita start.
Can.
Okay, Wafa, may I leave it to you?
Can you hear me, Madam?
Yes.
Very clear.
Very clear.
Okay. I start now,
Go ahead, Wafa.
Bismillahirrahmanirrahim. Brothers and sisters, Assalamualaikum warahmatullahi wabarakatuh. In the name of Allah, the most merciful and most compassionate, all praises to Allah for giving us the opportunity to be here for our event today. A very good day I bid to the Honorable and respected guest speaker, Professor Dr. Siti Rauzah Ghazali, Madam Asniza binti Muhammad, Senior Psychology Officers of CCSD, peers advisors, and of course, beloved brothers and sisters. First and foremost, I would like to thank everyone for spending your time attending to Night Talk on Mind Your Mental Health, Practicing Your Self-Love and Self-Care. To bless our ceremony for today, I would like to invite Brother Nu'man as the representative to lead the recitation of Dua. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh. Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wal aqibatu lil muttaqin wassalatu wassalamu ala sayyidina Muhammad wa ala alihi wasahbihi ajma'in. Ya Allah ya Rahim, praise be to Allah, the Lord of the worlds. Peace and blessing be upon our Prophet Muhammad sallallahu alaihi wasallam and his companions, and for those who follow his example till the judgment day. Allahumma ya Allah, we express our gratitude to you for allowing us to attend. Allah, We ask you for the safety of our religion and the welfare of our body. O Allah, Lord of the implementing authority, make the days that we have gone through, starting with your mercy, continue with your blessing and righteous guidance, and with the forgiveness. Ya Allah, Ya Muhaimin, Ya Aziz, Ya Jabbar. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Sallallahu ala Muhammad wa ala alihi wa sahbihi wa sallam. Walhamdulillahi rabbil alamin.
Amin, amin, ya Rabbal Alamin. Thank you, Brother Nu'man, for recitation of the dua. Moving on to the next agenda, let us roughly get to know our respected guest speaker's educational background. In 1995, Professor Dr. Siti Rauza Ghazali obtained her Bachelor of Human Sciences in Psychology from International Islamic University Malaysia IIUM. After a few years, she traveled abroad to earn Masters of Science in Clinical Psychology from Eastern Michigan University in 1997 and continued to get PhD in Clinical Psychology from the Union Institute and the University of Cincinnati, Ohio in the United States. Professor Dr. Siti Rauza Ghazali then started to expand her career as an academician in University Malaysia Sarawak UNIMAS, practicing clinical psychologist, researcher, administrator, and a consultant for some of the largest companies in Malaysia. Without further ado, let us invite the noble guest speaker, Professor Dr. Siti Rauza Ghazali, to begin her sharing. Please welcome.
Yes, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera and a very good evening for every one of you. Before I continue, let me close dulu. Saya punya WhatsApp ni bukan main lagi bising yang dum-dum Nanti habis semua orang dengar. First of all, thank you to Wafa, Wafa Yasmin Zulhanim, our pengacara tonight, pengerusi majlis tonight, for introducing me to all of you. And also thank you to Puan Asniza Mamat, my very good friend, a really best friend. You know, we were in the same class when back to 1995, even before. And we got to know each other for quite some time, even until now, you know. I can still feel, walaupun jauh, I'm in Sarawak right now, even though we are far, but we still feel the closeness, you know. Rarely talk, but once we talk quite a lot, you know. Alhamdulillah. And Alhamdulillah, tonight we have the opportunity to see each other online at the moment with me. In the Zoom, we have about 27 or 26 students. Yeah? Who do we have today? We have Adam, Haris, we have Afalu. Mata saya tak apa nampak dah sangat. I can't see clearly. We have Alia, we have Alia, we have Alia Patricia, sedap nama. We have Amira, Amni, Ari, Auni, Amir, Dia dan ramai lagi sampai dekat bawah tu ya. So Alhamdulillah, thank you for joining me tonight. And then I understand that there's some of you following the session dalam in YouTube as well. So we're going to talk about mental health, and inshallah, one thing that we're going to do is just santai-santai lah, what we call dalam bahasa Melayunya santai-santai. We don't really want to discussing so seriously. This is just at the end of this session. If you can take one knowledge, you know, take one knowledge that you can bring into, that you can remember or you can practice, I'll be thankful, you know. Alhamdulillah, I'll be so happy. You know, when we do some kind of lecture, 1 hour lecture, normally the attention span for the student is only 15 minutes. The rest dah tak berapa nak ingat ya. Kita akan jump up here and there dah lupa. Tonight, Puan Asniza asked me to repeat the same lecture that we've been giving to your junior last year. Mind Your Mental Health Program, Practicing Self-Love and Self-Care. When we talk about mental health issues, one thing that we have to really help before we can help other people is to equip ourselves with some knowledge about mental health, because our students come from a very different background. Even psychology student, it doesn't mean that they know everything about mental health, So that's why we try to focus on a few things. The first part of it will be like we're going to talk about basically life challenges, mental health situation among the university student. You are the university student at the moment. You have friends, a lot of friends around you, and when you go to the main campus, even larger friends will be you get to know a lot of other friends as well, in the main campus. So we're going to talk about depression, anxiety, very common mental health issues, psychological trauma, stress. It's very common that students have stress related or academic related stress when in the middle of a semester, a few weeks before exams, during midterm, those when the time that we have quite high level of stress. And we talk about very simple things, other things, obsessive compulsive disorder. We talk about schizophrenia, bipolar, maybe a little bit about personality disorder, just very simple one, self-harm, and at the end of the second part of it, just a little bit, if we have time, talk about building mental health resiliency, just some tips, what you're going to do in order for you to face life challenges. Okay, so basically that's what we're going to cover. If you ever want to have question, you just open the mic and you can say that Siti, boleh tak can we talk about something related to psychological trauma, for example? Further, I have a question. Let's do it, guys. This is what we're going to do. If, for example, you have a lot more question in the first section of the our session today, it's okay. If we can't do the self-care building, that's fine. Should you have a lot more question in the first session, okay? So I don't mind at all. We take it easy. If you think that you have a lot more question on anxiety, you want to know about depression, you have depression, you have psychological trauma, you really want to talk about it, the self-care and building mental health resiliency, you think that it's not as important because you want to learn more about life challenges, and self-awareness about all this bipolar, PTSD, personality disorder. Let's do it, okay? Sebab dalam in our life, knowledge seeking, ongoing improving ourselves about any knowledge will be until we die, So it's all right. If you think that, again, you want to learn about bipolar, my friend have bipolar, so how to handle, and you really want to talk about it, we can do that too, okay? So those what we're going to talk, self-love, that person is me, we want to emphasize on that three things as well, the third thing, and question and answer. That's basically what we're going to go through, very quick one. Now we talk about the section about basically my area of expertise, in which mental health situation among the university student. I've been doing a clinical work since 1997 when I did my master's degree in clinical psychology in the United States. Now, since then, I've seen so many cases, sometimes students ask me how many thousand people that I've seen. I don't count, to be honest with you. So if you want to calculate, maybe a year, I've seen about 700 people. I've been doing it for the last 28 years, 27 years, so you can come from there, So alhamdulillah, see, to me, there's a lot of things that I learned from students or from patients who suffer from mental disorders. in which it helped me to understand myself and also to help others. Yeah? So the mental health situation, number one, number one now is depression. Okay. Never at all in the history of mental health that depression higher than anxiety. We're going to talk about anxiety. Following pandemic now, depression is higher than anxiety in some university when we did some research, So depression essentially is feeling depressed. It's normal, guys. Kalau if you feel that you feel sad because people criticize you, if it's sad because you didn't get a good result or you didn't get result than what you expected, that is normal. In fact, it's not normal of analysis and then or a mental health question related to depression, and then we give to the student questionnaire and then students say no. So the result of total depression is 0. That is questionable. And to show you that people ups and down when you feel depressed is so biasa lah ya, kita panggil memang biasa. You ask me, have I been depressed? Oh yeah, of course. What were the incident that make me feel depressed? When I lost my mom, when I lost my brother, when I lost my best friend who passed away. Every one of us will experience some kind of loss or grief. So every one of us will experience what is depression. But depression is there are some symptoms. When you have a feeling of sadness, fearfulness, tearfulness, emptiness, helplessness, and hopelessness. You loss of interest in most normal activities. You have sleep disturbance. Students, sleep disturbance ada 3. Pertama sekali, first of all, you could not sleep at all. You couldn't sleep at 2 o'clock, at 3 o'clock in the morning. And you only can fall asleep around 5, for example. Tak boleh tidur langsung. That's what we call the first type of sleep disturbance. The second one, you could fall asleep, but you always get up every 1 hour. That also we call sleep problem. Some student told me that, Prof Siti, kalau saya depressed, saya tak ada masalah tidur. Elok je saya tidur sampai pukul 2 petang. That is problem, guys. When you have too much sleep and you feel that you don't want to get up until 4 p.m, 4 petang, that is actually sleep problem. So you have tiredness, you have lack of energy, you reduce appetite, you have a weight gain, weight loss, feeling of worthlessness, like I'm not a good student, I'm not a good person, I don't know what value do I have in my life, that I can give to other people, saya ni menyusahkan orang, saya ni tak ada apa yang ada pada diri saya yang saya boleh menyumbang pada orang lain, for example. Feeling of guilt, fixation on past failure or self-blame. You keep on remembering, I wish I could do well in my SPM. I wish I could do well in my PT3, for example. But in fact, you are in the university already, That's what we call fixation of past failure. It's not even failure. Some people who have depression, they exaggerate or make it so big about one small thing too. That they blame themselves, so that can be some of the symptoms as well. Trouble thinking, concentration, making decision, and remembering, social isolation. Recently, we had open day at our faculty of Medicine and Health Sciences. We invited a lot of students to come to our university, to our faculty, and then our department, Psychological Medicine department, we have a very simple game, for the school students, coping skill, healthy coping skill, unhealthy coping skills, I want to talk about social isolation. Almost half of the students said that isolating yourself, being alone as healthy coping skill. The answer was wrong. Okay. So it's actually the more you isolate yourself, the more you will experience depression. So social isolation essentially is natural or a very typical or very common symptoms of depression. Frequent thought of death, suicide, or even attempt suicide. Guys, if you have this the last one, yeah? If you have the last one, you should go ahead and call or go to your counseling center. Okay, this is very serious issues. Now, what else? Many type of depressive disorder. I'm not going to talk about it, because of there are different kind, but these are the common symptoms. And what else? Yeah, the second one is we're going to talk about anxiety. And anxiety is fears that we hope will go away one day. You always have things that related to, again, feeling worry is normal. Feeling fear is normal. But if you have this condition, excessive feeling of worriness, of fearful, nervousness, restlessness, of being tense, and feeling of danger or panic or dread, you always have rapid heartbeat, you always have rapid breathing, increase or heavy sweating, mengeletar selalu. You are the type of person whom we call selalu nervous, selalu gabra, selalu rasa takut, difficulty focusing or concentrating, again, insomnia or sleep problem, a strong desire to avoid things that trigger your anxiety, or for example assignment or lectures, you might have symptoms of anxiety. They are so, again, yang ini kita panggil panic attack. A panic attack is actually one symptoms. A group of symptoms consists of palpitation, feeling of shortness of breath, sensation, you rasa macam nak tercekik, sensation of choking, chest pain or tightness. A lot of patients or students, they feel that maybe I have heart problem, I cannot breathe, and then they come to clinic, our clinic. Actually, they don't have heart problems. When we check them, they are okay, but the chest pain seems so real. Nausea, or we have GIT problem, you have diarrhea, you have sembelit, for example, constipation, dizziness, lightheadedness, feel like you want to pengsan, atau kita panggil faint, feeling hot or cold, numbness or tingling sensation, feeling detached from oneself, depersonalization, fear of going crazy, or fear of dying. If you have at least 4 of these symptoms, you might have panic attack. And panic attack is one of the symptoms exists for different type of anxiety disorder. Okay. Kita ada 6 type of the anxiety disorder. I'm not going to talk about anxiety disorder, but panic attack is one of the symptoms, and the symptoms that I mentioned previously will be some of the symptoms. So you pay attention to yourself, whether you have those symptoms or not, okay? And what else? So stress, stress, semua there's a stress. People say it's a stress, pressure that I want to leave, I don't want to have it. This is too big. It is normal part of life, I've been telling the student, it is no fun. Examination is very stressful. I cannot imagine if I'm going to declare that, hey, you do not need to have examination, mashallah, examination, stress is good, so examination is type of stress, if you don't have examination, I cannot imagine what kind of students or quality of student we're going to have, So a little bit of pressure is good, for the student. In psychology, stress is a physical, mental, and emotional. Yang ini penting, factor that can cause bodily or mental tension, pressure, or strain. Now, some people, or some student, they say that tak apa bro, saya boleh study marathon daripada pagi sampai ke petang. That you neglecting the mental stress. Or physical stress, you terpaksa cari duit. For example, Sabtu Ahad you work part time, and lepas kelas, for example Monday through Thursday you work part time at night, you know, you are neglecting physical stress. Okay. Or emotional stress, you suffer from emotional distress, you've been abused, for example, or you being criticized heavily, you know, you just rebel sahaja, lama-lama kita tak boleh tahan, ya. And stress arises when individual perceive that they cannot adequately cope. Now, or demands that be made upon them, eventually it's threat to your well-being. Now, kalau you rasa, katalah ya, this is week, saya tak ingat week berapa. Kalau main campus sekarang baru week 2, second week, you know, of the lecture, you know. You guys tadi Puan Asniza kata you macam nak dekat exam. Ini kita kata perceived inability to cope. If you are almost to have exam, like 2 more weeks, you just realize that you don't complete your assignments. You know that your group assignment also not done yet. And somehow your midterm, you weren't doing well. You know, now thinking about your group assignment and individual assignment that's due in 2 or 3 days, as soon as you perceive that I'm gonna die, I'm not gonna be able to complete it. Perception saja, ya. You have not even faced it yet, you know. Your stress level will be high. Or you think about the demand you feel and think that you cannot cope, this is too much, you know. I just, normally human mind, we think faster than the computer, guys. So as soon as you think that you cannot finish your assignment, group assignment, individual assignment, and never mind about to study for final exam is 40%. Oh my God, I cannot cope. Oh my God, there's too much to do. You know, you have part-time job. Some of you have to go back during weekend to take care of your parents who are not doing well, and you start to think about threat to your well-being, you know. What could be your well-being? You think about your future, you know. It's all from one thing, one small thing, to manage your examination, to face your final exam, but your mind travel so far and so fast to think about, oh my God, what happened to my future? Oh my God, if I get all C's, you know, my CGPA will be really dropped down. I'm not going to be able to get the course that I want. How about my future? How about my ambition? How about what my mom and my dad want me to do, you know? You think about your parents' hope. You think about your scholarship, you know. You wish that you were going to get 3.7, 3.9 CGPA so you can get good scholarship in the main campus, for example. So again, this is what we call perceptions, all right? So those are some definition of stress, you know. So what happened is that essentially, eventually, when you keep on thinking about this, you know, and it's become excessive strain or pressure that lead to a distortion, just like mental health, lead to physical, emotional, and mental pressure or strain, and can lead to psychological distortion as a result of why you feel stressed, life challenges in campus, academic challenges, online classes, difficult to understand, financial constraint, relationship issue, ini dia relationship issues, broken hearted, ya, kita tahu boyfriend kita, girlfriend kita dah ada orang lain, Kita terasa hati, we feel hurt that our boyfriend or our girlfriend like somebody else punya Insta story, tapi lupa nak like kita punya Insta story, macam dia tak care pun dengan kita, you know. But orang lain punya Insta story elok je dia like, you jadi stress. Ini kita kata relationship issues. You worry about your mom and dad, they seems like not happily married, you know. Yang ini pun sama. Mental illness, when you come to UIA, you've been diagnosed to have mental health issues. You are on medication, but you don't want your friend, your roommates to know that you've been taking medication. You hide it and then you stop taking your medication. You have had those before you come to UIA, you know. Physical health problems, you know, you got to know that you have TB, you are suspected to have nauzubillah, you know, more serious illness, you know, that you've been hiding it from your friends and from your parents, you know. So those are the psychological or stress that can lead to psychological issues. And what else? What sort of stress that is unhealthy? Prolonged stress. You have certain issues that you don't want to deal with. What are other things? Repeated stress. Yeah. Every time you have relationship, you must have some spouse or partner or girlfriend or boyfriend that always betray you. For example lah, ya. Saya bagi example yang mana saya ingat. Oh, stress that you being repressed, you know. You've been going through life like parents who are very abusive, for example, that you don't want to deal with it. You know there's something not right about your parents or anything at all during your childhood, or somebody abuse you, for example. You've been keeping it to yourself, you know, you never share it with anybody else, you know. So that's what we call stress. That's been unhealthy stress. Poorly managed stress, you know, when you have the issues with your friends, every time you face a new semester, or this semester, you told yourself, you know, I'm not gonna repeat this mistake again. I'm gonna study early. I'm not gonna be. I'm going to concentrate, you know, from a very beginning. But the next semester come, you make the same mistake. That's what we call poorly managed, kan? Stress that's poorly managed. What else? Trauma. You have psychological trauma. We're going to talk about it. A stress that is negatively perceived. You feel that sincere betul lah exam ni, you know. I don't understand what is the purpose of exam, you know. Nothing good to the nation, or you start to exaggerate or try to make it really big, you know. The reality is that almost every university impose on examination. Yeah? So you everything negatively perceived, negatively reacted. That's what we call unhealthy stress. You know, every time you have issues with someone in a relationship, putus, let's break off, you know. Tak mau din. You don't want to look at what's wrong with you and her or him, you know, in order to fix the relationship. You don't want to do it. You just reacted to it. Let's say break off, senang, malas dah nak fikir. You know? And they keep on repeating, being repressed and poorly managed, and you don't want to deal with your trauma. That's what we call unhealthy stress. And now stress, when people, excessive and prolonged stress can lead to mental illness, you know, mental health issues, more serious one. You know, how are you doing? People ask you, you always talk, you always think, I'm fine, you know, but at the back there, you feel broken, you feel useless, you feel alone, you feel clueless, you feel confused, you feel betrayed, you feel fragile, on the verge of tears, you feel depressed, you feel anxious, about to break down, you feel annoyed, you feel lonely, you feel bitter, you feel rejected, you feel crushed. I feel like I'm going to just fall apart at any time. You feel empty, you feel defeated, you're never good enough. You hide your stress. in front of other people, dekat social media, you tunjuk selfie, I'm fine, you know. You want people to perceive that you are fine, you are good, you have no problems, you know. I don't want people to know that I'm clueless, you know, I feel pathetic, you know, I feel distant. No, I don't want people to know about it. So that is the reality of stress, okay? Some people at least, you know. Stress can make your mental illness or worsening, you know, affect your daily functioning, academic, relationship, and job stress. You know, some people, obsessive compulsive disorder. If you are stressful, you have obsessive compulsive disorder, a type of disorder that when an individual have to do things repeatedly, and kita call OCD, they want to be perfect, you know, when doing things. They keep on make sure that everything are tidy, you know. There's a few things that we can talk about OCD, yeah. And some people, they say I'm OCD, you know. I'm a little bit OCD. They're proud of it. Don't be proud of it. It is a type of serious mental health disorders, yeah? Mental disorders. So if you are stressed, you have OCD, it make your OCD even worse. If you have stress, you have bipolar disorder, you keep it to yourself, you know, it make your bipolar disorder worse, okay? If you have stress, you have schizophrenia, a type of mental health, mental disorder in which you hear something that and no one here. You see things that other people cannot see, you know. This is that so many type of schizophrenia, you know. You hallucinating, you believe that people try to hurt you all the time, people try to poison you, for example, and that's what we call schizophrenia. You have stress, it make your schizophrenia even worse, okay? Or major depressive disorder, a type of depression, but featured by your attempt, you might have attempted suicide, or you considering ending your life seriously. That's what we call major depressive disorder. If you have stress, if you have major depressive disorder, and you do not manage your stress, it make your major depressive disorder even worse. You have PTSD, post-traumatic stress disorder. We're going to talk about it. You know, you got into car accident. You know, you have trauma. You keep on thinking about those traumatic experience. You did not deal with it. You don't get help from it, or you do get help. You are receiving treatment for PTSD, but you have stress. It make your PTSD even worse, okay? And the second one, you have narcissistic personality disorder. You are the type of person who basically feel that only you are important, only you are capable, and you have stress. It make your NPD or narcissistic personality disorder worsening. Ya, jadi lagi bertambah teruk. Saya nak pastikan kita tak overboard, nanti you penat ya nak exam. Masya Allah, self-harm and suicide behavior. Dear Lord, please give me strength. A lot of people around the world. Guys, when I talk about self-harm or suicide behavior, even though my topic about the university student, but trust me, self-harm, suicide behavior is actually increasing globally. Globally, bukan Malaysia saja. Bukan Malaysia saja. Bukan Southeast Asia saja. It's not, you know, in the United States, in Europe, in China, in Japan, throughout the world. You can read the WHO, World Health Organization prevalence, you know, this throughout the world. Self-harm, suicide behavior, suicide attempt or completed suicide, mashallah, you know, increase. Following the pandemic, a lot of things related to mental health issues, you know, increase. bukan di Malaysia saja, bukan di UIA saja. Kadang-kadang kita jumpa sometimes when I saw friends or colleagues from other university, they say, oh, kenapa banyak sangat sekarang dekat universiti kita orang. Tak ada. Dia bukan macam tu. Bukan dekat Unimas sahaja, bukan dekat UIA sahaja. Throughout the world. Especially we did a study among the university student. I've done a study as well among university students. I've been publishing mental health issues related to university students, It's increased tremendously. Okay, following pandemic. Banyak sangat, Masya Allah. Ni self-harm. When someone deliberately hurts or mutilates their body without meaning to die. That's what we call self-harm. We had interviews, with a few students, what does it mean if they hurt themselves, They said that they can feel it is actually temporary, the pain is real. Sometimes they have psychological issues. They see that why mak ayah ni bergaduh je, bergaduh je. Nampak mak ayah duduk separately, When during pandemic, you just realize, a lot of youngsters just realize that actually, you know what, my mom, my dad are not happily married, It's so painful to see. You keep it, you do not manage it, you never ask your parents what's going on. You feel that it's too much to ask, you're afraid, you are fearful, So you keep it to yourself and then you feel not good, Some students, some individuals, some adults, ramai ada beberapa orang, tak ramai lah, Saya silap lah saya guna perkataan ramai pula. Those who try to harm themselves or attempted or harm themselves, they said that they feel good about it, It is unhealthy coping skills, guys, that's not healthy, but there are people who's doing it. I'm sharing with you why they're doing it, okay? Sometimes you might have friends, you might have children who's doing it, but this is the main reason. Not everybody who self-harm want to die. No, not everybody. Okay. Unhealthy coping, unhealthy coping, do not do it. So we're going to talk about resiliency sekejap lagi lah. Suicide behavior is a desperate attempt to escape or suffering from the things that has become unbearable, some people, we don't want to talk about the students sahaja, anybody around us, sometimes you try to get explanation why they're doing it. They're blinded by feeling of self-loathing, hopelessness, isolation, and they can't see anything or any way to relieve except through death, But they had different type of suicide behavior, suicidation, but never want to commit suicide, suicidation and intend to commit suicide when have opportunity, have attempted suicide but never successful, risk to try again, so they try a few things, sometimes which is nowadays, we try to have so many different suicide prevention program, to help our students, not only our students, to the public as well. So why we want to talk causes of depression, anxiety, and stress, and also suicide issues among the student, adjustment issues. First time being away from family, food are not delicious, room is not that comfortable, So you rasa stress sikit lah, academic adjustment, major shift from high school to university or campus life, you kind of shock. You have like 5 or 6 subjects, and at one point, and then you have exams within 4 months, you have to do a lot of homeworks. You have some adjustment issues. Stress, academic stress, 6 subjects in 4 months with 6 quizzes, 6 midterms, 6 individual assignment, 6 group assignments, 6 final exam, and 6 individual or group presentations, so stress. Personal stress, parents have marital issues. We talk about it, broken-hearted. Guys, these are your age when it's very common that you have relationship, Bukannya tak boleh ada relationship. Saya selalu bagi nasihat dekat anak-anak saya dan juga pelajar saya ya. When comes to relationship, always pray for the best ya. Walaupun kita dah ada pasangan, kita dah ada boyfriend, kita dah ada girlfriend, you already have boyfriend or girlfriend, always pray to Allah, oh Allah give me the best, you know. And some of the student they said, tak maulah Prof, saya dah ada dah, saya nak dia juga jadi jodoh saya. You buat solat istikharah, you know, sebenarnya you nak dalam istikharah you nak Sulaiman tu juga jadi you punya husband, you know. Your boyfriend is Sulaiman, so you nak kahwin juga dengan Sulaiman, you know. You buat istikharah. Ini istikharah orang muda. But the truth is that when you make dua to Allah Subhanahu Wa Taala, is that always pray the best. What does it mean? Pray the best, guys. Untuk jodoh. What does it mean? What does it mean is that you pray for the best. If Sulaiman is your jodoh, ada ke Sulaiman hari ni? Tak ada ke Sulaiman? No. If Sulaiman is your jodoh, you pray, may Allah give this jodoh Sulaiman become someone whom you can accept him unconditionally. And he can accept you unconditionally as well. He can accept your strength. He can accept your weakness. You can accept his strength. You can also accept his weakness. Okay? Pray for the best. Kalau tak jadi, if you tak jadi dengan si Sulaiman ni, you always pray for the best. Sulaiman will find somebody who's better than you. You will find somebody who better than Sulaiman, and Allah give both of you calmness to face the challenges of broken-hearted. Ya, itu nasihat saya dekat student, dekat anak-anak, dekat anak buah. You know, always pray for the best, even though you have someone whom you like so much. You know, you dah ada boyfriend or girlfriend. One of my student always said, saya still berdoa supaya Sulaiman juga jadi the best. Tak apalah, you nak doa, you personal doa. Ya? Tapi bila kita berdoa dengan Allah Subhanahu Wa Taala, Allah sebenarnya lebih dekat daripada nyawa kita sendiri. So kita, Allah Maha mengetahui. Kita berdoa lah. Allah Maha mendengar. Apa lagi? Financial issues, guys. Masalah, we have a lot of financial issues among our students. Nowadays, computer kena beli yang up to date, ya, yang canggih-canggih. Parents lost jobs. Some parents still do not recover from their job loss since pandemic. Health issues, need more money, you know. Issues related to your own personality, excessive feeling of shyness, external locus of control type of person. Essentially, external locus of control ni people who always feel happy when they got approval from other people. For your age, I always advise when you use social media is the major issue that cause the young generation, your age particularly, you know, to feel stressed. If you use social media, what you need is like, jangan, you know, because of now that you depend on other people to make you happy, you know. So when you use social media, please consciously, you have purpose. What is your purpose? To share, to let other people know, or to record, or to document? You know, mesti ada purpose. Kalau kata you nak popular, tu payah sikit. Because you have to make sure that hundreds of people to like you, and then you have to fulfill their requirement. How you can make yourself to be like that? A lot of works, okay? And very sensitive type of person, excessive attachment to a friend. You are the type of person who are very possessive. You know, kawan, ini you punya best friend, BFF. Bila your kawan ada kawan lain pula, you dah rasa macam dia tak suka kat saya dah ke? Kenapa dia tak pay attention to me and all those things. Ini kita panggil issue related to personality. Ya. lack of self-confidence. You got 3.7 CGPA. I had a student who came and see me, 3.7 CGPA, want to drop out from university, feel that I'm not that good enough. I don't think what I got from the first few years of the university or dekat sekolah menengah is good enough for me to come to the university, you know. That's what we call lack of self-confidence. Health problems, I did mention about it. Existing mental health issues, including addiction problem. Yang ini pun saya nak sebut. You know, kadang-kadang pelajar universiti dia nak stay malam, dia ambil drugs. Janganlah ambil drugs. You smoke or you use vape. You know, we have a lot of reports in medical reports right now that those who vaping, you know, have a very terrible outcome of your of physical health, you know, your lung, your heart, you know, terrible outcome. So don't vape. Pornography. Pornography ni, Masya Allah, such a huge issue. So if you need help, the main campus counseling center have developed some kind of manual, self-help manual. I was involved in that manual as well, you know, to help how student individually can manage their pornography addiction. Game addiction, Masya Allah. Ramai yang student suka main game. Kena kawal. Isu ni memang boleh jadikan a cause for you to feel stressed, to feel anxious, and to feel depressed. Other causes, new environment, new challenges, separation from stronger support system. Macam anak saya pernah duduk dekat Gambang, datang daripada Sarawak. Jauh sangat. Nasib baik Madam Asniza Madam Asniza rajin bawa anak saya keluar. Dia selalu selfie, dia kata, "Aunty, Asniza bawa pergi sini." She looks so happy. Young program, your program is not your first choice, Masya Allah. You know, you nak ambil program lain, UIA bagi lain. Yang ini pun boleh jadi stressful situation. Uncertainty about your future, university life make you realize there are many challenges ahead. You know, masuk je university, Masya Allah, ramainya budak-budak pandai. I thought that I'm the smartest one. Tengok lagi ramai yang pandai. Masya Allah, macam mana nak dapatkan CGPA tinggi ni? It's so hard, you know. You just realize that something, there's huge challenges. You still blur, you know. Students selalu cakap blur lagi ni, Prof. Tak tahu nak jadi apa. I'm sure nak tukar subjek, you know. Even though you have enrolled, you know, macam mana you still want to do law, but you are in human science program right now, you know. So still struggling. Family responsibility, family members' illness, you know. Some of you worry about your parents who are sick, you know. Adik-beradik yang sakit ke. Worry about younger or disabled sibling. You have sibling who are OKU, you know. You know that all this while before you go to the university, you are the one who help your OKU siblings. Now your parents are busy. You keep on thinking about your brothers and sisters at home, you know. We do have that issues as well. If you read berita Harian Metro today, it's huge news. One of our university students said worry about who's going to take care of the brother. Psychological trauma, the wound that I want to heal. You guys, some of us going through some psychological trauma. Childhood is one of the best experience in life, you know. We enjoy our life, we play, we have a lot of friends, you know. But some people, they go through painful childhood to remember, or even recently, guys, affect physical and psychological health, profound influence on your adult life. And in a Greek word, we call that wound or psychological pain. And essentially, psychological trauma is an emotional response to terrible event like accident, rape, or natural disaster. According to American Psychiatric Association. So you will suffer from shock, you suffer from denial, you are angry, you feel sad. Yeah? So there's so many symptoms of PTSD or post-traumatic stress disorder. You feel fear, you feel fright, you feel anxiety, you have a little bit of depression, you feel painful memory that you could not get rid of, feeling life will never feel the same again, feeling life is constantly full of danger, feeling constant threat to your safety. So those are we call trauma. What is the source of trauma? It could be sexual abuse, it could be childhood neglect, it could be physical abuse, it could be horrific death, accident, for example, robbery and hostage, and robbery. I still remember one of my close friend who being robbed, and she told me that she wanted to sell the house. That's what we call trauma. She said that every time she wants to come home from work, she feel that this house is no longer safe. Itu kita panggil trauma. What else? Natural disaster, banjir. Baru-baru ini tengah sibuk banjir kan, kita tengok di Terengganu, some of other state, kesian sangat. Tak ada rumah. Rumah dulu ada, tengok hilang dah, tak ada. That is what we call traumatic experience. Apalagi you have cancer, terminal illness, and you have serious surgery when you were young, even recently. Of course, war and combat. Tetapi kita ada family members who serve in UNICEF, who serve in Lebanon, Lebanon. And guys, war or combat, recently we found a study that if you excessively follow any news in social media, you might suffer from post-traumatic stress disorder. That's what we call secondary stress. Issue related to Palestine, issue related to Ukraine war or any other war can seriously affect your mental health. What domestic violence, you know that your mom or your dad have some kind of unhappy issues that lead to domestic violence, that can be traumatized to you too. Terrible car accident, Masya Allah, Malaysia. Kalau you tengok newspaper, tidak ada satu hari pun yang kita punya newspaper sunyi dari berita kemalangan. Almost every day, guys. So take care, jaga baru-baru ni some university student kena langgar. Tak salah diorang kena langgar, Masya Allah. Unimas student pun pernah juga berlaku kemalangan kemalangan jalan raya, Masya Allah. I've been dealing with them, it's so many of them Satu yang ini saya nak nasihat sedikit dengan university student. You nak travel mana-mana, do not go out at 2 a.m. in the morning. You will be at risk of getting involved in car accident because of microsleep. Microsleep is very, very dangerous, guys. It just happened few seconds and then boom, you get into car accident. You were tired. Young people, they always think about tak ada kereta di jalan, so senang nak drive. You forget about your own safety. Malaysia is among top 4 in the world that have fatal car accident in the world. I have studied about PTSD, post-traumatic stress disorder, among teenagers. I found that car accident is the third source of trauma among our teenagers. Drowning pun sama. Di Sarawak, drowning is number 4 source of trauma. Apa lagi yang kita ada? Separation and divorce. For children, when you were young, you see that parents separated or going through divorce, you do feel that you are traumatized. Marital crisis, dia taklah domestic violence, tapi bapa yell at your mom yell at your dad, sama-sama kuat, dia orang menjerit. School bully, Masya Allah. My master student has been doing research about school bully. The prevalence is high, guys. If you have any issue related previous school bully, you want to talk about it to your university counselors. Yeah? Sexual assault or harassment. Masya Allah, some students suffer from sexual assault in the school setting, you know, siapa yang duduk asrama also, they experience some sort of sexual harassment, dekat sana. Physical assault, it doesn't matter by who, but still by trauma. Fire, kami dekat Sarawak banyak sangat isu fire ni, kebakaran. Kalau you tengok baru-baru ni dekat Sabah ada, ya. So this one can be cause of trauma. Okay, now 9:42. Do you guys have any question about mental health issues? Ada sih? Cakap Sarawak lah pula, ada tak? Any question? Siapa yang hadir hari ni? Kita ada partisipan kita. Kita ada siapa ni? Kita ada Nawar, Najma, Nadia, Muna, Mardia, Masya Allah, Hadif, Fatnin, Fatin, Fakihah, Dia, Din Amir, Auni. Do you guys have any question at all? Ada tak soalan pasal mental health? Dekat chat. Sekejap saya tengok dekat chat baru nampak. How to manage if you have depression and anxiety? This is very good question. Thank you, Alia. Your friend asked me question. Don't worry lah, Alia. Walaupun saya sebut nama Alia, tak apa. This is very excellent question to me. Doesn't mean that Alia has depression or anxiety. Tapi dia tanya soalan. Mungkin dia tanya soalan on behalf of her friend. Macam mana nak manage? I give you some tips. We're going to talk about building self-love and psychological resiliency. Now, one thing that you should know when you need help, okay? When you think your depression to the extent that you have suicidal ideation, you need help. Tak boleh manage sendiri, ya. Sampai you rasa that you've been harming yourself, that's another tips that you need to see professional. You have to see Puan Azniza Muhammad. What else? If you have not been sleeping for 3 days straight, you just could not sleep at all, not even an hour. You need professional help. Okay? Sama juga anxiety. When you feel so anxious to the extent that you don't want to go to classes. In fact, you did not go to class many times because you feel that people are looking at you. People are trying to, you just feel suffocated. You have palpitation. You feel shaky. You feel so worried. And to the extent that you could not sleep at night, you always have berdebar-debar, berderau, shaking, you need help. Those are the kind of thing that Alia and friend, you could not manage it yourself. Mesti pergi jumpa counselor. Kalau you tak nak, if you don't want to see counselor, you can go to any clinic. All medical doctors are trained to see if you need to be referred to psychiatrist or not. Yeah? Kalau you rasa malu nak pergi jumpa Puan Azniza, you pergi jumpa mana-mana klinik berdekatan and tell them your symptoms. Okay. Now, you are not in this category. You just feel like depressed, feel low, recently you broke off with your boyfriend or girlfriend, you let go, you tahu tak ada jodoh, tapi you just cannot forget about him, cannot forget about her. You still sayang, tapi dia tak nak teruskan hubungan. Benda ni is so depressing, guys. Sedih sangat. You rasa macam tak boleh sangat nak manage, ya. Macam mana lah nak buat. Of course, saya akan minta you guys pergi jumpa counselor. Tapi kalau you tak nak, you have to, those who are depressed and anxious, you guys have to stick to your routine. Do not isolate yourself. Yang ini yang saya kata unhealthy coping. You have to have healthy coping. Walaupun, even though you are introverted type of person, but if you experiencing depression and anxiety, you have to bring yourself to be surrounded by other people. How you do it? You pakai headphone macam saya ni. You bawa dengar music, you bawa buku, you sit dekat cafeteria. So you will not be lonely or alone. Okay? And the more you isolated yourself, you don't want to go out, you want to be alone by yourself, the more you feel depressed. Second, if you are anxious, if you are anxiety, if you have a good friend, for example, any friends, you can express a little bit. You can share a little bit. You can talk to your mom and dad, for example. Kalau mom and dad boleh the type of person who listen, you know. If you don't trust your mom and dad, for example, you know that your mom and dad are very busy, you know, you can talk to your brother. You can talk to your sister. You can talk to your best friend, you know, BFF. You can talk to uncle or auntie, someone that you can trust, someone that you can, when you talk to them, be calm, you say, depressed lah, kadang-kadang sad sangat, you can just express to them and share. Tadi jangan be alone, boleh share a little bit, and make sure that you stay busy. If you cannot focus on your assignment, for example, make sure that you get involved in any non-academic activities, so it gives you a start up. One remarkable thing about depression is that feeling of emptiness and loneliness. With the activities, you feel that gap. Okay, you feel that gap. Okay, what are other things that you can do? Hey, take care of yourself. We're going to talk about self-love, ya. Nanti kita cakap pasal self-love. Building resiliency, in other words, how to take care of your depression and anxiety when they are not arrived at clinical level yet. Yeah, we're going to talk about it, that one too. Okay. Another direct messages from somebody else. What if you feel like you burden others, so you doesn't want to find help? If you feel that you burden others, that you don't want to find help, that is very huge issue, man. You feel that you burden others. Oh my God, I want to know what sort of burden. You know, kalau saya rasa saya membebankan seseorang, that's huge. What aspect? That's huge question. You cannot just be by yourself to answer that. You know, let's go and get help from your counselors. Now, that's huge. It's very centralized issues. You know, you are the burden of others. Oh man, that's huge. Yeah. So feeling burden of others is just doesn't come out of the blue, you know. Feeling burdening of others, it could be anything. It could be that you suffer from it when you were so young. Somebody said something, kau ni menyusahkan hidup aku. Oh, Masya Allah. Some student had that word, you know, from their own parents, you know. You really burden, you know, to our family. You're not like your brothers. You're not like your sisters. Oh, that's a huge issue. Okay. Come and see your counselor lah. Yeah. isu yang melibatkan beban, menjadi beban kepada keluarga ni ataupun you are burden to someone. I would imagine normally this kind of dialogue is related to parents. Then you really need help, especially when it is related to relationship and that relationship with your parents, One thing about university student, guys, that I really want to share with you is that I've been telling this to lecturer, all lecturers as well. A lot of people do not understand that you are adult actually, but you are the type of adult who who do not have freedom on your own. Yes, you're adult, but you don't have financial freedom. Your parents give you money, but you cannot make decision, to buy whatever you want to buy. You kena berjimat. Kadang-kadang what parents give to you was not even enough. You are adult. You're supposed to make your own decision. Even you want to choose courses, you're not allowed to choose your own courses. Your mom said you need to do medicine. Your mom said you need to do psychology. Your mom said you need to do computer science in order for you to have career or job employability in the future, So those are the issues among university students. You are adult, but you cannot make your own decision in many ways. Okay. So those are the kind of struggle when you have, and sometimes to get you confused to the extent that you feel you are the burdens of the family. It could need more interpretation. It could be your wrong interpretation. It could be misunderstanding. It could be the reality that you have to face when your parents say that is so painful and you cannot bear it. I could not give the answer until we talk about it at length to suit into what does it mean that you are the burden for others. Okay? These are the kind of issues that it has to be individualized. All right? So we're going to talk about a few things. Oh, ada lagi soalan. That's good. All right. Salam, madam. I would like to know how to respond to a friend's problem in a way that we don't shift the focus to us, because sometimes I feel like a response such as same, I've gone through that before, would be improper and invalidate her feelings. Yeah. I mean, this is what we call communication skills. Yeah. In the medical school, I'm teaching medical students, validating feelings, validating emotion, validating the facts of life, validating of your behavior, respond or giving a right response is higher skills of communication. Yeah. Yesterday, I was talking with one of my patients, and basically they have argument in their relationship, and I told them very specifically, I told them that actually you guys are not communicating. What you guys have been doing is talking. Talking and communicating is two separate things. Communicating require you to have active listening. Sometimes, to answer your question, and sometimes when your friends tell you about her problem, what she or he needs is only one thing: for you to be a good listener. You don't even have to respond sometimes. You don't have to find solution. This is the biggest mistake in communication. As soon as your friend said something, so sama lah kita. Macam like, as if like, if I can deal it, why not you? Apa yang besar sangat isu kau? Aku pun lalui juga benda ni. I'm going through the same thing, man. So basically that's what it is. So that is inappropriate response. Normally, number one is just active listening. You can just say being empathy, well, what you've gone through. I've never gone through. I really don't know how you feel, If you don't know how you feel, it doesn't mean that, oh, aku faham lah apa yang kau lalui. You can say that you don't understand, I'm sorry. How can I help you to make you feel better? Kau bagi tahu aku lah macam mana kau nak aku buat apa. Aku tak tahu lah nak tolong kau macam mana. Kau tell me what you want me to do. Sometimes kita kena bagi balik. You have to give back to your friends, how can I help you? I've never gone through this. I'm sorry that you have to go through this. Even that kind of simple response will be useful. Hey, if you want to, I have to teach medical students at length for communication skills only. Puan Asniza and me, we're going through a training semester after semester to just develop communication skills, So that's why for the students, this kind of program or event, validate feeling is good. Do not give solution is good. Jangan bagi solution. Tiba-tiba alah kau putus je lah. Dump je. Dump je dia. Dia tak like kau punya Insta. Dia like orang lain punya Insta. Kalau aku dump je. Don't do that to your friend, Sometimes dia sayang lagi tahu dekat boyfriend dia. Dia masih rindu lagi, rindu lagi dekat boyfriend dia. Dia masih lagi mengharapkan hubungan tu diperbaiki, improve. You suka hati je suruh dump dia. Tak maulah macam tu kan. So we talk about validating tadi. Atau being empathy. Tell them that I've never gone through that. I'm sorry, I cannot imagine what you've gone through. Number 2, sometimes just active listening, just dengar saja. Keep asking, oh ya ke, you want to tell me more about it? That's the kind of response that better instead of. Number 3, don't give solution, Jangan bagi solution. Aku rasa kan, kau tukar je lah. Of course. Kau tak happy ni dekat dalam kau ni. Kau tukar je lah. Kau tukar. Nanti mungkin kau happy. Tak boleh. Cannot. So those are the few tips lah that we can share how to manage. Saya nak cari mana tadi saya punya chat tadi. Oh ya, dah jumpa balik. So those we don't shift. Of course. Memang we again, those who are peer counselor, they learn about this. When your friend talk about her issue, do not shift it to your own issues. Focus on dia saja, Paling-paling pun kadang-kadang kita tak berapa mahir sangat. Actually kau punya masalah sama macam aku, tapi tak apa, let's talk about your own. Mungkin masalah kau dengan masalah aku lain. Kadang-kadang kita ada urge nak cerita sama masalah kita ni sama. You cakap je sebaris. Lah, aku pun pernah lalui benda ni. Tapi tak tahulah kita punya isu sama ke tak apalah, kau ceritalah what's going on. Apa jadi, mungkin masalah kau dengan masalah aku tak sama, Kau ceritalah kalau kau rasa selesa, Kalau kau tak selesa, kau cerita apa yang kau mampu setakat ni, Let's hear, we'll see, Maybe kita boleh fikir sama-sama kot, kita tengok. Aku boleh bagi pandangan je, Tak nak bagi solution ni aku tak reti sangat, Tapi at least, what's going on, Maybe can ease your burden, Those are the kind of techniques that can help lah, apa lagi ada? Can anxiety, ni ada satu lagi soalan, ada orang yang hantar dekat Wafa. So Wafa hantar dekat saya. Dia kata on behalf of someone, the audience, can anxiety and depression be fully cured? Or are there any condition that they need to manage throughout their life for them to feel be cured? Of course, boleh. Banyak. I've been treating depression and anxiety for so many times, guys. One, anxiety and depression can be cured. Banyak cara. Tetapi apa syaratnya? One of the syarat is that you are the one as a patient, you know that you need help. Number one. Second, you have the motivation to recover. You know, you really want to be free. You kena ambil medication. Kalau yang perlu medication lah. If you come for therapy, you are scheduled to see therapist or psychologist, tiba-tiba you dah tak mau datang pula, dia susah nak recover ya. Tapi kita ada student who suffer from depression and post-traumatic stress disorder. The patient, the student lost the entire family members dalam car accident. Masya Allah. Saya pun tak boleh nak bayangkan if I go through that kind of experience. Masya Allah, it's so hard. So she suffer from PTSD, post-traumatic stress disorder. We talk about it, and she also suffer from depression, losing parents, losing everybody. Tapi saya sangat respect dia punya motivation. Tak pernah miss ubat. Tak pernah exercise. Dia buat exercise. Kita bagi holistic approach. Exercise, jaga tidur, ambil ubat, datang for therapy, dapatkan sokongan daripada orang lain. 3 tahun kot. Daripada tahun 1 sampai tahun 3. I can see that she is so much stronger than before she went through those traumatic experience, losing of the family. Yes, you can recover from anxiety, guys. You can recover from depression. You can recover from schizophrenia. Schizophrenia is a lot more serious issues, depression and anxiety. There's so many good story about how people recovering from it. Do you have to take medication for the rest of your life? It depends on your motivation to go through to the treatment plan. The issues is that like this. Saya ni banyak lah nak share malam ni. Some student, they attempted suicide. We put them on medication. After 3 or 4 months, they feel better. You know what they did? They stopped the medication abruptly without even consulting the psychiatrist. This is sangat tak bagus, sangat bahaya. Sebab ni bila kita bagi antipsychotic, kita bagi dopamine or serotonin, enhancing all those neurotransmitter, and then boom, you stop the medication, you stop the tiba-tiba you akan jadi down tau. You akan jadi down, you are at risk of attempting suicide again. Yang ini yang kita selalu sangat lalui. Kadang-kadang parents impose on the student, Anak saya dah okay dah, Prof. Saya dah berhentikan medication. I said, oh my God, bila tu? Oh, lama dah, dia kata. I don't think that's a good idea. Medication ni, you nak berhentikan boleh tau. Tetapi kena consult psychiatrist. Kena sikit. Berapa miligram daripada 50 ke 25 ke 15 ke 5 miligram, So you kena ada, you tak boleh just like suka hati. Tak boleh, because of those kind of medication, it help the neurotransmitter in your brain that affect your mood, your depression, your bipolar, your maniac, symptoms to be controlled. So tak boleh. You can recover from depression and anxiety, providing that you want to help yourself, you are motivated to help yourself, you know what's going on in your mind, and you are faithful that you can recover. Boleh. Ada. Yes. Ada yang recover. That's my answer. Saya tengok ada chat lagi tadi. Dalam chat tu saya tak jawab tadi. Okay, yang ini saya dah jawab. Okay. Yang ni pun ada satu. Fully cured. Yes. What if you like burden to others? Afraid people will judge you. Yeah, anxiety is actually a type of mental health issues when you always afraid that people judge you. Yes. That's why when you come for therapy, we going to give you cognitive behavioral therapy in which we specifically challenge your negative cognition, the way you think. People don't like me, people hate me, people always looking at me, those are social anxiety. Social anxiety is a type of anxiety disorder in which so many university students suffer from it, especially for those who really get involved in online classes for significant years. So when they come to the university, they don't feel comfortable. They were studying online for many years, for 2 years, and they come to the university, or they were at the school system in which they fully online. You basically absence from or deprived from social skills, social interactions. You suffer from social isolation. So as a result of that, ramai sangat yang suffer from social anxiety. So yeah, one of the symptoms that you're afraid that people judge you. In fact, I can demonstrate you come for the therapy that no one judge you. The feeling is only arise from perasaan takut and nervous. Okay, I think that's all. What we have. Any other question? Kita ada lagi 22 minit. Kita cuba habiskan self-love and building psychological resilience. This is what we're going to do a little bit. How well you can do. Basically, psychological resiliency ni is a type of ability, a type of skills, a type of psychological inner ability, dalaman, that when you deal with certain circumstances or challenges in your life, you have the ability to bounce back from difficulties, from that difficulties. So you the type of person who can maintain a positive outlook and cope with stress more effectively. Ini kita panggil resiliency lah. You go through stress, you go through challenges, you've been criticized, you've been degrading, sometimes a lot of things going on in your life, but you can remain calm. Guys, I always think that being happy is the most important thing, when I was young. But as I grow older, one thing that we always need is actually being calm. Sebabnya kita tak akan sentiasa happy dalam dunia. Apa yang kita nak is calm. Being calm, the ability to being calm in the events of in the circumstances that we've been challenged, mentally and psychologically. That's a part of resiliency as well. Resiliency required to change behavior, thoughts, and action that eventually promote personal well-being and mental health. Kalau you nak jadi resilient, dia ada benda yang you kena buat, basically. Changes that you have to do in order for you to become a lot more resilient person. So you can develop the ability to withstand, adapt, and recover from stress and adversity, apa-apa cabaran yang ada. Now, a lot of people do some studies. They show that some people, they naturally become resilient, but some people, they can benefit from learning how to become resilient. Dia tak semestinya ada orang yang were born resilient. Yes, there are people, but some of all these skills you can learn. Number 1, find a purpose of life. Saya tanya dengan medical student saya tadi. What is your purpose of life? A lot of students do not have answer. What is your purpose of life? Anybody want to try dalam chat? Anybody kah? Tengok. Adakah siapa yang nak try dalam chat? What is your purpose of life? Adakah? Anybody? Purpose of life. Yes, saya tengok ada yang jawab ni. Thank you so much. Sukanya saya. Beribadah. Yeah, beribadah. Make parents proud. Yep, make parents proud. Worship Allah, Masya Allah. Worship Allah, ya. Saya selalu bagi tahu dekat mencari keredaan Allah. Yes, you know, matlamat kita hidup di dunia ini mencari keredaan Allah dari semua kehidupan. Nak kahwin, cari keredaan Allah. Belajar, dalamnya kena ada keredaan Allah. You nak melempang orang, you nak melempang orang. Fikir 2 kali. You nak pandang rendah kat orang, Allah redha ke tak? Selamba dia kata, kau tu, fikir 2 kali. Ini kita kata purpose of life. You contribute to people. Yes, you want to contribute. You ada duit RM10, you nak bagi RM1 dekat Palestinian. For example, you nak sedekah dengan anak yatim, you nak bina masjid, contribute to other people. Ya, kita tak banyak bagi. Kita ada RM10, kita bagi 20 sen dekat sini, bagi 30 sen dekat sana. Itu je, sebab kita bukan orang kaya, kan? Tadi pun my student kata, the purpose of life dia nak jadi kaya. Salah ke tak nak jadi kaya? Tak salah. Saya selalu bagi tahu dekat anak-anak, jadilah kaya supaya kamu tidak menjadi hamba manusia, ya. Bila kita kaya, kita boleh memberi. Bila kita boleh kaya, orang nak bagi bribery dekat kita, kita kata no thanks, you know, I have my own money, go away from me, you know. Penting juga, ya. Yes, I have a case of 15 years old teenager with multiple history of attempted suicide, you know. One thing that I asked her is that, what do you want to be when you grow up? She looked at me and bright and said, I want to be a lawyer. MashaAllah, I said, you know, you have a purpose in life. As soon as we talk about purpose in life, being a lawyer, you know, her eyes is bright. She thinks so far about it. The hopelessness is not there. Maybe her entire life is hopeless. But when she talk about her future, her purpose of life, you know, she become a lot more brighter. Yeah. Final year student who has to repeat his exam, you know, again, I ask, you know, I don't ask that what you want to do to pass your exam. No. I always ask, hey, what do you think you're going to specialize when you become a doctor, you know? He said, Prof, actually saya nak sangat jadi neurosurgeon. You know what? Those are many years ago, guys. And he become neurosurgeon, you know. And that's really good. Sometimes kita, when you repeat, I told my children this, you know, I have 7 children, you know, most of them your age. It's one purpose, you know, can give you motivation, can spark a lot of things in your mind, you know, open to a lot of opportunities, open to so many things, you know, ahead in your life, you know. Only one purpose. So the second one, trust in your ability, you know. A first year student who believe that she is not smart and not capable, you know. I asked her, what was your CGPA? And dia kata 3.7 saja, Prof. Masya Allah, 3.7 saja, Prof. How many students get 3.7? I said, 3.7 CGPA is good CGPA, you know. This is what we call perception stresses. When we talk about stress and perceptions, you know, you want to be perfectionist. That's another thing that we have not talked about. Some people, they want to be perfect, you know. Sebenarnya kita bukan manusia sebagai hamba, you know. We are the servant of Allah. We are not perfect, you know. So if you lawan that fitrah, you want to be perfect, naturally you're going to put up so much pressure on you. Studies have shown that those who have perfectionist, being perfect or being perfectionist, personality, they are at risk of suffer from cardiovascular diseases, well established, guys. Suffer from cancer, kita panggil risk ya, bukan bermaknanya orang yang suffer from cancer tu dia perfectionist, no. Risiko menaikkan risiko, menambahkan risiko. Someone who have unhappy relationship, you know, being perfectionist. We'll talk about it, you know. A Form 5 student who thinks that her uncle hates us, you know. Again, when you communicate with certain people, you know, sometimes you speculate a lot about what other people think. You are so busy interpreting what other people judge about you. I said, what did exactly your uncle ask you? Well, you know, I got 5 A's in my SPM. And then my uncle asked me, what am I going to apply? I told him, I don't know, maybe I'm going to apply diploma sana, diploma sini dekat X university or X college, you know. You know what my uncle said that's really hurt my feeling? I said, yes. What did he say? He said that I should apply to law school. How can I apply to law school? I got only 5 A's, 6 A's, just like that. I said, really? So you mean that when your uncle proposed that instead of going to do diploma, and instead of doing diploma, you should really apply for law school? That is an insult. You think that you don't have the ability to become a lawyer because of that? Yalah. You do not trust the ability, honey. I think with 6 A's, you can be a good lawyer. I think your uncle is right. You don't trust your ability. You put your ability so low. She's looking at me. She feel like, ya kak. Tarik nafas balik ya. Tengok. Baru dia perasan. Listen to your own voice. Find one positive word. Write it down and say it out loud. You guys should do it by now. You tengok, you fikir. Apa yang ada? What is your ability? Each one of you should just write it down by now. Only one for tonight. Tomorrow night, one more. The third night, 2 more. You know, kita semua ada ability. Trust your ability. Establish positive relationship, social relationship and communication. Ini menjawab juga soalan yang Alia tanya tadi ya, on behalf of your friend about how to manage your depression and anxiety. Guys, the more you have depression, the more you need to communicate, the more you have to have friends, you know. Study have shown that people who are lonely, who are isolated from from friends and social network, their brain shrink. Their brains shrink. You can Google it. You can study in the neuroscience study. They found that people who are feeling lonely, constantly feeling lonely, constantly isolate themselves from the social activities, their brain shrink. They have MRI on it. They follow people who have depression. Then the major symptoms was loneliness. Kita dapati otaknya mengecil. So students, our Malaysian student susah sangat nak jumpa lecturer. Pelik saya. Anak-anak saya pun macam tu. Saya sampai kata, adalah sekarang ni anak saya okay lah. They always go to see lecturer, Takut sangat nak jumpa lecturer. Professors, university counselors or coursemen, nak communicate. Takut sangat, especially lecturer and professors, They feel that lecturers and professors eat them. We don't eat you guys. You should come. Medical student always come and see me. Saya ada offer satu kelas. Tajuk kelas saya Understanding Self elective. My student, I encourage them to come and see me. We always communicate. We always talk. Normally among first year student. Lagi satu elective class yang saya ajar. Psychology of Love and Relationship. I like these two classes. Student always enjoy this class and talk about it. A third year engineering student who felt like he was on the edge, could not finish assignment, overwhelmed with midterms, This is a case of private university, who came to see me and then he cried. Basically, he said that I have 2 more weeks exam, prof. I could not submit my apa dia panggil? Thermodynamic. Apa ke nama that courses. Tak dapat lah, Prof. Yang ini tak dapat. Yang ini nombor 2 tak dapat. Nombor 3 tak dapat. Nombor 4 pun saya tak dapat. Assignment. Saya, have you contacted your professor? Dia kata, macam mana nak contact, Prof? Saya takut. What make you feel that your professor, you takut? I'm so afraid. Tak apa. Kalau you takut, biar saya tolong tuliskan email. You tulis email sekarang macam ni. Nama saya Siti Rauda binti. Dear Professor Ali, nama saya Siti Rauda binti Ghazali. My name is Siti Rauda binti Ghazali. I am engineering student year 3. My CGPA was this. Dear Prof, I still could not finish my assignment 1, 2, 3. I've been struggling. I'm going through difficult time this semester. I have a lot of assignment that I couldn't finish. I think I have anxiety or maybe depression. Prof, could you please give me some extension to finish my assignment? CC to Prof Siti Rauda binti Ghazali. You know what's the answer? He was so afraid. The answer from all the professors was so sweet. Dear Ali, take your time. You can submit your assignment the latest, even 1 week before final semester, you can submit the assignment. I wish you all the best. I hope you can manage your anxiety and stress. A lot of people, a lot of students facing these very difficult issues, Sweet. To lecturer nombor 1, lecturer nombor 2, I'm sorry that you have to go through this, you may submit your assignment later. Lecturer number 3. See, sometimes student full of these assumptions about lecturer, macam mana nak tulis kat lecturer, nanti lecturer tak bagi ke apa. Yes, the worst thing that can happen, the lecturer said, tak boleh, you kena submit juga on time. Masa tu you redha lah, kalau this is the kind of thing that I'm telling the students. If you have assignment, you baru siap introduction, you only complete your section 1 and section 2, conceivably dari 20 markah, you can only deserve 15 marks, You ask your professors. The professor said that kena submit juga kinet sekarang. Orang Sarawak cakap kinet tu. Sekarang juga. You know what you're going to do? Submit sajalah. Kenalah redha. Lecturer tak bagi. Bagilah submit. At least you dapat berapa? Okay lah, 7 daripada 25. Ada juga markah. Yeah. Being a university student, you have to have different outlook, different way of thinking, guys. Memang kena lain, ya. Focus on actual life interactions. Pergi jumpa lecturer. Jangan WhatsApp. Call your lecturer, call your friends. Don't fight in WhatsApp group about your group assignment. Selalu bergaduh pasal group assignment. Jangan bergaduh. Bawa berbincang, ajak kawan-kawan face to face. Apa lagi? Yang inilah saya bagi. Cara-cara nak dia doktor apalah. Kenalah tulis, ya. Yang ini saya tolong tuliskan. Ada student saya yang tolong tuliskan, ya. Kadang-kadang student takut. Saya minta kebenaran dengan student. On behalf of the student, I wrote to the lecturer. Ini saya bagi contoh lah, ya. Ini saya bagi contoh je, ya. Apa lagi? Establish positive social communication and relationship. Like I said, again, they feel worried to contact lecturer. Kita almost finish lah. Embrace and adopt in change in life. Be a flexible person. Do not be perfectionist. Kena ikut aja kita punya routine. Tak boleh masuk university. You have to be flexible person. Yeah. Enjoy multicultural friends. Enjoy COVID-19 pandemic, rich of experience. Now you are at the university. Be optimistic, guys. As soon as you masuk university, one thing that you have to think about is that you are selected student. You passed that screening process. Now you are among the pool of the students who are qualified to be in Gambang. You qualify. Jangan tengok belakang balik, saya ni qualify ke tak? Alamak, ada orang better. Memang ada orang better in your life. If you are rich, there's always somebody richer than you. If you are beautiful and pretty, there's always somebody else prettier than you. If you are strong, there are always somebody else who's stronger than you. But what you need to do is that thankful to what you have, be optimistic, you trust to your ability, and take action. Just do it. Say Nikes, building great personality require positive change in thinking, feeling, and behavior. Some people said, think positively. If you cannot think positively, you just do it. Studies have shown that people who's doing it, even without thinking about it, it can change some area in the brain that improve mood. You tak nak pergi exercise, tapi kawan you paksa juga pergi exercise. The fact that you just go exercise, even though you being forced to do it, is still benefit to you. That's what I said, take action. It doesn't matter whether you like it, you never done it before, but you just go ahead and do it, is still good for you. Okay. Develop problems, skills, find solution, consult authorities, get advice. Nak extension ke, nak drop class ke, financial issues ke, go and find the authorities. Pergi jumpa lecturer. Pergi jumpa coordinator. Go to finance office and talk about your financial issues. Don't just sit and suffer from it. A second-year student who feel depressed when his parents decided to divorce. Guys, this is big issue among university students. When parents get divorced, what they want is that don't divorce. At the back of divorce issues, there are so many things that children do not know that parents keep in their room. Okay. Bila mak ayah sudah tidak ada jodoh, guys, let me tell you, leave them alone. Sayangi kedua-duanya walaupun mereka sudah berpisah. What you need to do is to respect your parents' decision. You can't force them, guys. Tak boleh. This is the reality of life. They had enough. It's sad. Sedih tak? Oh, sedih. Of course. My first year student who has brother that abused drugs, saya kata call AADK. Malu, Prof. Tak boleh malu. When involved with drug, this is what we call problem solving call. Abang saya menagih dadah. Dia ada bawa dadah ke rumah. Tolong datang segera. You make mistake, ask apology. Guys, dah 10.31. Saya tak nak simpan you guys lama sangat. Sebab nanti saya di antara individu yang sangat mementingkan waktu tidur student. Ya, saya tengah promote waktu tidur yang bagi saya yang sangat penting. Those are the 8 things lah ya. Saya bagi. Saya boleh je share share slide ni dengan you all. Dengan Puan Azniza. So those who comes today can have my slides lah ya. If you want. Boleh Alia. Saya boleh bagi ya. I think that's all for tonight. Do you guys have any question? I'm more than happy to answer any question for now. Alia, back to you. Wafa. Ya Allah. Wafa Yasmin ya. Go ahead, Wafa. You still mute, Wafa? Go ahead, Wafa. Ada soalan tak? I give back to Wafa. Wafa, you boleh ke? Ke ada connection? Dengar dah Wafa. Yeah, go ahead, Wafa.
Okay, so there's someone asked me about how do we can actually set realistic study goals when we have a short term of period for us to prepare for the exam without feeling overwhelmed and maintain a healthy mindset. Yeah.
Oh, that's really good question. Sekarang ni ada masa berapa, Wafa? Ada berapa minggu sebelum final exam?
Around less than 2 weeks.
Less than 2 weeks. Berapa subjek you ambil, Wafa?
Kalau for me, I take 3 subjects.
3 subjek sikit lah, taklah banyak sangat. You know, ada student yang ambil 5-6 lah, yang ada Arabic dengan dengan
ada yang ambil 5.
Ya, ada yang ambil 5. Kalau 3, for example, you ada 2 weeks, you tengok midterm result. You tengok midterm result, tengok mana yang carry marks yang bagus. It depends on you punya strategi lah. Ya. Tengok carry mark yang bagus. Kadang-kadang ada student, they still cannot finish their group assignment. Yang ni selalu. Group, some students, they have group assignment, they have individual assignment. A lot of students ask me which one do they want to finish first. So what is your rule of thumb? What do you want to finish first? How do you choose which one between group assignment dengan individual assignment? Ada student is very selfish, you know. They just said, I'm going to finish the individual assignment first lah, because a group assignment somebody else can do it. Oh my goodness, you know. So that's really selfish, you know. How is the way? What are the way you can determine you want to do group assignment or individual assignment first? Ini problem solving dalam resiliency, developing resiliency. Wafa, if I ask you, how you want to choose? On what basis you want to choose? Individual assignment or group assignment? Kesian Wafa kena pula malam ni.
Kalau personally kalau setakat ni semua assignment setakat ni semua group assignment. But kalau diberi that kind of situation, I will regroup my assignment first, my group first. Mesti kita orang akan bahagi part masing-masing, discuss dulu di outline, and then buat part masing-masing, and at the same time boleh buat the individual assignment juga.
It's good. One way of doing it, you have to discuss with your own group. You know, kadang-kadang kita kena tengok dalam group assignment tu how many percent. Tengok mana percent. Kalau group assignment is 40%, guys, ataupun 20%, and your individual assignment 5%, So yang mana you kena prioritize. You kena prioritize group assignment. Sometimes you have to talk to your group members, hey guys, discuss. My individual assignment is actually 30%. Our group assignment is only 15%. So can I prioritize first my individual assignment? It's just so natural. This is what we call problem solving. Talk to your group members, So again, second question. You ada dalam group assignment, you ada 4 orang Yang seorang ni memang tak nak buat langsung. So what are you going to do? Problem solving.
Kalau I akan advise dia dulu. But if lah kalau macam kita dah bagi kerja kan, kita dah buat kali memang dia tak nak respond, I will just report to the lecturer lah. Because buat apa nak susah-susah kan, macam nak fikir pasal dia. Since kita dah try our best.
I would agree with that, but there is better version of it. The better version of it, apa-apa portion dia you kena buat. Sebabnya apa? Dalam di tempat kerja nanti you akan face this kind of person in your life. Memang ada seorang dalam group, dalam office, dekat tempat kerja is very common. Dalam adik-beradik pun sama kan. Kita ada 5 adik-beradik. Nombor 1 rajin buat kerja. Nombor 3 selalu curi tulang, It's common. This is human nature. What you're going to do is that 3 of you finish your assignment, report to the lecturer. That's the best way. At least his portion, you know what is the purpose of assignment, right? You have to sharpen your knowledge. You have to add your knowledge in that particular subject. When you do it, you learn about it. You tak rugi tau sebenarnya you buat kerja lebih. Orang yang rajin tak pernah rugi. Remember what I said. Ambil aja assignment tu, buat, pastikan you dapat 40 markah daripada 40 markah. Jangan kerana ada rasa hatred, ada rasa kerana benci, you tak tahu actually you tembak your own kaki, You yourself dapat markah yang buruk. And I like the idea of mengadu dekat lecturer. Memang kena mengadu. Supaya kita bentuk balik sikap kawan kita yang buruk ini. Kalau saya jadi lecturer, memang dia tak dapat markah. Kalau saya jadi lecturer, saya takkan bagi markah student yang tak contribute dalam group assignment. Ada soalan lain tak? So kalau tak ada soalan lain, I think that's all for tonight. Kesian nanti student ada yang takut nak leave the group. I leave it to you, Wafa, to end the session.
Okay. Thank you so much, Professor Dr. Siti Rauza Ghazali, for the beneficial and insightful sharing. So, Alhamdulillah, we would like to express our utmost gratitude towards Professor Doctor for lending your precious time to share such a detailed input regarding common health issues faced by students and how we can build the psychological resiliency to recover from the mental illness. Personally, as one of the peers community under the CCSD, this information is really helpful for me to contribute better towards the students if they even ask me again, so that I can contribute towards the well-being, the better well-being of students. Yeah, that's all. Thank you so much.
Thank you. I sent my email in the chat group. You can always email me if you have any question related to mental health. If you need any help, memang selalu juga saya dapat email daripada UIA student. Kalau dalam Twitter pun selalu je saya dapat DM. My Twitter is my name. Saya tak pandai pakai Twitter. Saya pandai tweet sahaja ataupun X. Saya masih lagi panggil Twitter. Saya pandai tweet sahaja tapi saya tak pandai reply. Kadang-kadang saya reply sikit-sikit aja. So you can follow me in there ataupun you can DM me there or you can email me at gsrauda@unimas.my. Saya mohon ampun dan maaf sekiranya apa-apa yang saya kongsikan malam ini ada yang negatif ke, yang inappropriate ke, yang baik tu datang dari Allah, yang sebarang kesilapan, kekurangan adalah kekurangan saya sendirilah ya. I'm sorry for any mistake that I've done, especially dekat YouTube ke apa kan, nanti kita tidak mahu ada salah faham ya. InsyaAllah mudah-mudahan kita jumpa lagi lah di masa akan datang. Okay.
Terima kasih.
Thanks thanks guys. Good
Tak puas,
night.
tak puas sebenarnya. Kena
Nanti
panggil
insyaAllah.
datang separuh hari session.
Itulah insyaAllah. Nanti kita buat lagi insyaAllah. Dah tak pandemik ni kita boleh fly and jumpa dekat Kuantan, dekat Gambang insyaAllah. Okay. Have a good night sleep guys. InsyaAllah see you again.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.